Hello, everybody. I'm Claudia. I'm a research officer at Nuffield Council on Bioethics, and I'm very excited to be joining this conference today and to present the work that my team and I have been doing for the past year or so, which explores the ethics of emerging technologies for mental health care. But first, I'm just going to give a little bit of background on our organization and the type of work that we do. The Nuffield Council on Bioethics is an independent body funded by the NAFA Foundation, Wellcome, and the Medical Research Council, and we inform policy and public debate on the ethical and social questions raised by biological and medical research. With this piece of work, our aim was to identify the key ethical and social questions raised by the use of technologies in mental health care and to synthesize views and available evidence on this. Our focus was on digital technology, including apps and chatbots, virtual reality and other immersive technologies, predictive analytics, but we also looked at consumer neurotechnologies, including portable brain recording and stimulation devices. Our approach included desk research, series of one-to-one interviews, an exploratory workshop, and we also commissioned Rethink Mental Illness to run a series of engagement activities involving people with lived experience of mental health problems. Overall, we engaged with a diverse group of stakeholders, including researchers, mental health professionals, academics with experience in different fields, mental health charities and other organizations with an interest in this topic, and of course, as just mentioned, people with lived experience of mental health problems. In engaging with these different groups, our aim was really to hear the views on research in the field and the current advances that we could consider as part of our work, the benefits and challenges of technological forms of mental health support. We really wanted to hear their personal experiences of using digital and remote technology, also during COVID-19, and how people would feel about the idea of integrating digital technologies in mental health services and what they would like to see in the future of digital mental health tech. This work led to the production of a bioethics briefing note highlighting the key ethical and social issues to be considered in a context of mental health technology, and also a summary paper produced by Rethink Mental Illness, summarizing the outcomes of our engagement sessions. These were both published on 28 April 2022. So here's a summary of what we learned through this work. Virtual support has the potential to increase access to care, for example, by helping to reach those who find it difficult accessing in-person care or are not comfortable in doing so. At the same time, it could also exacerbate existing inequalities because whether or not people can access technological forms of mental health support depends on a number of factors, including their income, housing situation, digital literacy, and importantly, their willingness to access digital treatment. As some of the participants to our experts by experience engagement sessions have pointed out, we should never assume that everybody has access to digital technology, safe in a private space, and that everybody wants to access digital forms of mental health support. It is important to consider that technology can play a key role in connecting people. For example, it could help connecting clinicians and patients by giving clinicians access to much more information about patients' everyday life, including their habits, feelings, and moods, for example. And it can also help connecting patients who are going through the same experiences and would not normally have a chance to meet because, for example, they live in different parts of the world. At the same time, if mental health care become increasingly contactless, it is important to reflect on the impact that a lack of or diminished in-person human contact may have on those seeking care. For some people, for example, this could exacerbate feelings of loneliness, isolation, and a sense of disconnection from communities. And this is very important because for many patients, community participation, peer and group support, and other activities involving face-to-face interactions can make a difference in the recovery process. It is also important to reflect on how this could impact the therapeutic relationship between patients and mental health professionals. Research shows that some technological forms of support can be very effective. However, some have pointed out that there's a lack of evidence supporting the use of some technologies, for example, some commercially developed apps, And as a result, it is not always clear to potential users whether these forms of support are safe and effective to use. There are also some concerns, especially among service users, with regard to data privacy and security standards. While information about health is always sensitive, it could be argued that information about mental health status is even more sensitive, and people do worry about the possible ways in which that information could be used, by whom, and they do worry about the possible consequences of data breaches involving sensitive mental health information. So here are some final thoughts. There is so much that can be achieved by safe and effective digital technology for mental health support, and it does work well for many people. However, this is not the case for everybody, and alternatives to technological interventions should always be available, including hybrid forms of mental health support, to ensure that everybody has a choice to make. As new technology for mental health support emerge, it will be very important to build that sense of trust in the effectiveness, quality, and safety of these interventions. This is still an ongoing work, so if you are interested in knowing a little bit more about what we're doing in this space, please keep in touch. Thank you very much for listening, and I hope you enjoyed this presentation.